Jamie Crespo, a senior attorney with ChangeLab Solutions. Thanks for tuning into this video to hear more about the importance of public health law training. At ChangeLab Solutions, we envision a public health workforce that is equipped to advance health equity through community partnerships, legal research, and action on law and policy. As part of this work, we've partnered with the Centers for Disease Control and Prevention's Public Health Law program to better understand how academic programs can prepare the next generation of practitioners to both understand and use the law to improve health outcomes. In this video, we hear from 4 professionals in the field. They'll describe their experiences in public health law in their work, how law is an essential tool for protecting the public's health and promoting health equity, and what they believe is the most important issue in public health law today. We hope you enjoy and learn a lot.
I would like to start this answer by stating the definition of population health by David Kingdon. And so we look at the distribution of health outcomes, the determinants that influence that distribution, and the policy and laws and interventions that affect the determinants. So we must understand that public health and the health of populations is heavily influenced by laws and policies and public health interventions and services. Not all policies are health policies, but all policies have an impact on health, especially if we use a definition by the World Health Organization, or WHO, as they define health as being the complete state of physical, mental, and social well-being, not just the absence of disease. So laws and policies can either improve physical, mental, or social well-being or harm physical, mental, or social well-being. So as it relates to public health goals, if we consider the framework in health and all policies, we can move closer towards achieving public health goals set out by our core functions and the essential services of public health.
Well, the way I see it, public health is all about prevention and making sure that we are attempting to do what we can to address the conditions that affect health outcomes as early in the process as possible.
The law has always played a critical role in ensuring that public health goals are not only identified, but that there are plans in place that provide guidance in successfully addressing public health concerns. Laws are the container by which goals can be formalized between the government and the public. Laws ultimately shape the environment and subsequent actions that follow. So if you think back on public health movements such as addressing maternal and infant health, cardiovascular disease prevention, even occupational safety standards, all of these movements have relied on or been rooted in the law to provide that roadmap between addressing the underlying concerns or the environment and then moving towards more preventative models, all positively impacting public health.
So the role academia plays in advancing health equity is to use our research findings to inform and support policy decisions that are backed by scientific evidence. So academia can help support evidence-based decisions by those who are proposing and drafting new policies, public health policies, new public policies, and laws.
I think that academia also plays a role with education as it relates to equity and public health law, especially. I think that our responsibility in academia is to provide the education that ensures that future public health practitioners are equipped with the necessary knowledge, the necessary skill sets to impact law and policy. So not just the understanding of how law impacts population health, but how to interact with law itself, how to potentially influence it or how to interpret it, and really knowing how to navigate the law landscape.
Well, to an extent, public health departments are essentially, the keepers of a lot of understanding about population health and tracking of data and information that can be used to inform the status of the population and help you to also identify those populations that are most at risk, or those that are experiencing the most difficulty, so that you can sort of target your intervention. And so you combine that with the access and the desire and the willingness of public health to engage with community and to help work with them to not only better understand the nature of the circumstances that affect people's health, but to partner with them in sort of co-creating a system and a space upon which, you can better impact health using not only the expertise of public health professionals, but the lived experience and the expertise of the people in those communities. That's a means that, public health can use to mobilize communities and help bring that to bear in affecting health equity through our collective impact on law and policy.
Housing professionals play a vital and necessary role in advancing health equity through a public health lens. In their day-to-day work, housing professionals and advocates can see how housing disparities negatively impact health outcomes for everyday people and entire communities. Concerns such as poor and unlivable housing conditions, lack of access to affordable housing, and the continued impact of redlining on Black and Brown communities are still felt today. Housing advocates can use their collective voice and power to drive decision makers towards policies that are rooted in equitable health outcomes. They also play a crucial role in undoing policies and practices that have harmed and continue to harm communities still today.
What's most important is a foundational understanding of how laws are created and how they're enforced. We have a very complicated legal system in the United States, especially when it comes to public health issues. Future practitioners need to understand and navigate the basics of law. I think that this includes knowing how to identify crucial decision makers and their nuanced authority, their roles, their jurisdictions. I think that also taking that a step further, students need to understand the mechanisms through which to engage with these decision makers. But in addition to this foundational understanding, I think it's very crucial that public health students learn how to engage with the policy process from start to finish. This includes comprehensive landscape analysis, stakeholder mapping, literature reviews, policy analysis, media advocacy skills, coalition building, and even effective written communication, all with the purpose to engage with the law.
In terms of how public health law comes up in my work, I, as a manager, actually lead a team that's called the policy section. And one of the things that we do is we're focusing a lot on policy and what it pertains to health equity, social determinants of health. And one of our biggest levers for that is our state health plan, which is essentially written in statute to require us as an organization to develop an agenda that sets the stage for how public health should operate based on a wide range of information that we collect from a wide range of data sources and engagement with community. And that is meant to be a lever for moving our field here in Wisconsin in a direction where we can all be working towards the same goals. And in the state health plan that we have developed, the state health improvement plan, the goals of that are working towards policy, system, and environment change and affecting the conditions that create opportunities for health. And what better way to engage with that than focusing on policies, again, that are codified into law? And what can we do in partnership with others to start making some inroads and setting the stage for circumstances that can create better opportunities for health collectively and are leaving fewer pockets of people who are underserved or underrepresented or marginalized, and bringing that to bear to improve all of our collective health by also focusing our attention in spaces where it's of most need.
Through my work in addressing homelessness and housing issues, it is clear that public health law is a crucial piece to the puzzle. The Center for Disease Control and Prevention has even identified homelessness as a public health law issue, citing that close connection between declines in physical and mental health for those who have no home, and clearly outlines those legal underpinnings between homelessness and the root causes of it. We have so much data and information at our fingertips, in addition to best practices, innovative models, and all of this is showing positive outcomes. And that information can only help us as we guide policymakers towards addressing the root causes of homelessness through an equity lens.